The words that come to my mind for a hospice house is compassion, tenderness, caring, and that's not only for the patient, but it's for the whole family.
It's hard to believe. I mean, when we first came here, it was a bit like walking on the moon because we'd never had patients in our building before.
Well, the dream is everything I thought it would be, and so much more. I think the impact of what we can provide and the enhancement of adding a facility like this for patients and families at the end of life surpasses what we could do in the acute care setting.
This has kind of been not only Donna's dream, but everybody in the community's dream is to have this facility and to have it be not only open, but that we've cared for so many people here over a year is just crazy.
The time has flown by thinking, wow, of all the different patients that we've actually cared for in the facility.
When we talk about the number of people that we've had the privilege of taking care of here, it's a little bit unbelievable in some respects.
It's gone by so fast, and it's wonderful having this facility to work out of. It's wonderful environment, and I'm just glad that we are able to be a part of this and be present in this building.
Making something that's invisible, was very invisible in our community, now is made visible by a building. And people, what is going on in that building? What is hospice? What are the levels of hospice care? Hopefully that's the conversation that started over this past year. It's probably one of the greatest gifts is watching this dream unfold and becoming a reality, and the stories coming to life, not just thinking about what this building could be, but in this last year we've put the stories to life, and we have real people and real faces and real opportunities.
Families feel that they can come here and be with their loved ones and be comfortable in that setting.
My sons and my daughter even couldn't believe the atmosphere in here.
One thing I always tell my patients and families is that their families get to be family members here.
The wife can be the wife, the kids can be the kids, and they don't have to be the caregivers.
Say if they're in the home, they don't have to worry about cleaning the house, making meals, and still caring for the patient, which now they can just come and just spend time with their family member.
What are we going to do today? That is a message that we ask patients and families all the time. We're not just waiting for death to happen and waiting for the end to come. What are we doing to live today?
We would sit at the dining room table, we would play games, we could hear laughter coming from our dad's room.
Our families can come and use the kitchen, make meals.
Playing cards here, having birthday parties.
Families and friends have come here to celebrate a birthday.
We talk with Judy, we come out here in a lobby by the fireplace and chat, and it's really a great environment for just being here is a good experience.
The things that have happened in these walls, you know, you could write books. It certainly brings tears. It brings great, profound satisfaction. But as Vernon's vision is that we're doing everything we can to enhance patient and family care.
The first thing we hear from them is there's just a peacefulness and calmness about this facility. It's welcoming and it's home-like.
Once they're here, they just are so thankful and feel so blessed to be here and to spend their last days here.
It's just so nice to have the space for families, you know, to be able to be here with the patient.
Everything's pretty much state-of-the-art. I mean, you couldn't ask for a better place to come to.
We've had patients say this is the gold standard, this is the way hospice should be.
I find this such a pleasant place to come to that it's kind of a pleasure to come from home and be here and spend time with her, and friends that come to visit her are friends of mine too.
My favorite part is the screened-in porch.
The screen porch.
I think that kind of the general consensus is the porch area.
You shut the doors and it's like this building just kind of disappears and you can be outside with your family.
It's such a nice area. It's lovely back there. It's peaceful.
There were some days a couple weeks ago that they brought Judy the bed out here actually on the porch here, and it's wonderful. It's a little different than being in the air-conditioned building, and there was a little gentle breeze.
There's no restrictions. If they want to go out of their room and they're still in a bed and they can't get out of their bed, this facility allows for that patient to be taken right from their bed out to any part of this facility to be a part of the family.
This is really what it should be at a person's end of life, providing them the best that we can and making this process as normal and natural as possible.
I always said that they took as good a care of us as they did my husband.
You're taking care of people at one of the most intimate times of their lives is the end of life. And so you get very connected with the families because you're helping them through that process.
We built a wonderful relationship with them. Like I said, they were really kind and gentle and good to us.
I can't say enough about the staff. I always call them my angels. They're angels here on earth.
People say, well, isn't it really hard to work in hospice? But, you know, I tell them and they're shocked that I say hospice patients are some of the most upbeat and that they're always trying to give care to everybody else.
Every person that comes in here, some of them are tougher than others, but they either teach you something or they show you something and they don't even realize that they are.
This is the greatest and hardest job you'll ever have, but the greatest gift you'll ever give and receive from your loved one and from my patients. I mean, they give me gifts every day.
I think the resonating theme here is that one gets more than they give. And if we all live like that we were giving, continually trying to give more than we receive, I think the world would be a better place. I feel that hospice and end-of-life care is one of those callings. It's not for everybody, but those that it is that fit, they find that magic of being able to continue to care day after day in the midst of much sadness.
It's more rewarding than I could even have imagined, being able to be a part of end-of-life care for patients and their families.
It is very rewarding to see patients come to terms with the diagnosis that their family member's been given.
It's an honor, it's a privilege. I'm humbled to actually be able to be a inpatient hospice nurse.
For me as a person, it's a privilege to be a part of this as well and to work with the people that work here and believe in what we do and knowing that the community believes in us enough to have wanted to have this facility here.
If you can make someone's end of life be the best that it can be and the most comfortable that it can be, that makes all the sadness kind of disappear because you helped someone and their family through something so difficult.
At time when a patient is getting close to the end, our staff has taken their handprint and they ink it and they put it on a piece of parchment paper with a poem that talks about this is my handprint and these lines and these creases and what they mean.
They gave us this candle that had sat outside his door, and we got to take that home, and so from time to time we turn that on.
They put his handprint on a piece of paper and there's a poem that goes with it, and that was really special for the kids and myself.
It was an experience that, if you can say it was beautiful, it was, because it was the right place to be for me and my family. Through the last year, that is
There were several of us that made promises to Dr. Bland as he was leaving this world. And I several times a day, in my own mind, look around this building and it's like, oh my goodness, what would you say? What would you think? And I think if Dr. Bland was able to say anything, or Bud say anything, they would be busting with pride. Again, blown away with what we thought was going to be a wonderful idea, what we thought was going to be a wonderful way of caring for people. Again, to be blown away with what the reality became. And Dr. Bland would say, good job, well done, and let's keep going, and what are we going to do next?